Is there a positive association of air pollution and diabetes?
Well, this is a difficult question to answer because we have some conflicting evidence, and several studies do show associations, others do not, and we still have to find out the reasons for that. What I can say though is that if you look at more preliminary endpoints like glucose control and insulin sensitivity, we have some very good evidence that there is actually an association. Toxicological studies in vitro and in vivo experiments also give us very good evidence for an association. So considering the sparseness of the epidemiological evidence, I think here the next step would be to really conduct some very good prospective studies on diabetes incidence, where we also very carefully assess the exposure, look at the outcome, and also look at potential confounding other exposures that might also play a role.
In subjects with diabetes, particulate is associated with increased blood pressure, and ozone is associated with decreased blood pressure. How to manage these situations?
Well, I'm not sure whether we're really at the point to clinically manage it at the moment. You're pertaining to a specific study where we looked at diabetic patients and we looked at the short-term influence of air pollution on their blood pressure. What we actually saw was that short-term exposure to particulates raised blood pressure by 1 or 2 millimeters of mercury, whereas ozone actually decreased blood pressure a little bit. This was a specific patient population and one specific study, so we definitely, before we can actually look at clinical consequences of this, we need to do some more studies on this. And in general, of course, for diabetics as well as for anybody else who has high blood pressure, the most important thing in the first place is to treat blood pressure very well.